Okay, as Joseph said, I will have two presentations. The first one is the presentation of the Björn Hibel, who is the coordinator of the biggest in Europe and I think world's largest school survey on substance use called ESPAT. But I see that the first is my presentation on the screen, so we can change the order. So I will start with my presentation, and I will see. I will present the ESPAT as a second one. So before the ESPAT presentation, some our Polish experiences in evaluation of the drug policy. What is evaluation? This magic word which is very frequently used by the policymakers, by the researchers, by the practitioners. The evaluation could be considered as a fundamental requirement for effectiveness and rationality of the drug policy. Why? Because we need to know how our projects are implemented, how the policy is implemented. We also need to know what are the outcomes of our action, and also what is the contribution of our action to the change of the situation. So we have three types of the evaluation. Process evaluation, that means this assessment of the quality and extent of the action. Outcome evaluation, that means the answer for the question how the situation changed. And then the impact evaluation, the most interesting and in the same time the most controversial, most problematic type of evaluation. That means the question to which extent our action really contribute to the changes of the situation, to the changes of the outcome. And there are a lot of methodological problems related to all three types of the evaluation. So always the results should be taken with a lot of limitation, restriction, reservations. And what are the relationships between the evaluation and monitoring? The monitoring provides data for evaluation. Evaluation could be considered to be assessment on the basis of this data collected in the scope of the monitoring. And I would like to show some Polish experiences of outcome evaluation. That means to show how the situation changed in the period of last 20 years, and try to formulate at least some hypotheses how the policy influence the drug situation. And the main data sources which are based for this evaluation attempts, they are school surveys, population surveys, national statistical data, from the various institutions which respond to the drug problem, like law enforcement, treatment, and there are also the results of the cohort mortality studies among drug addicts. And firstly, some words about the Polish drug policy. And in the 80s, in the 90s, in Poland, the prevention activities was mostly focused on the youth and consist of the lectures given by the police or by the drug treatment therapist or former drug addicts. And the goal of these activities was to convince young people to maintain abstinence, and mostly by scaring them. Other type of the activities, they were the organization of the leisure time alternatives, and also mostly focus on the sport activities, and there are also some incidental actions, but always focus on the youth, and mostly on the youth who didn't yet use the drugs. And there were very limited impact of those prevention action on the behavior of youth. And there was, in the end of the previous century, the call for the more effective strategies. A new approach which was developed since the beginning of this century, or at least half of the previous decades, was the attempts to implement theory-driven prevention and evidence-based practice, like action focus on the risk and protective factors, differentiated action according to the target groups, the long-term activities designed as a program instead of the incidental action, and the most interesting, I think, and also the most powerful, the local community-based approach to the prevention. And what are the results of this action? Here on the slide you can see the lifetime prevalence of the drug use among 15, 16 years old students. This data came from the SPAT, about which I will talk later on. And you can see that the upper line illustrated the percent of the lifetime cannabis users go up. It was some fluctuation into 2007, but the trend is increasing. When we look at the other lines, which illustrate the other prevalence of the other drug use, we can see that it was the increase till 99 and then the decreasing trend. So we can formulate the hypothesis that at least when our other than cannabis drug into consideration, we have the positive outcome. So we can formulate a hypothesis that the drug policy contributes at least to this decrease. When we look at the cannabis, we can see that we cannot say about the success. And this lifetime cannabis use we can see on the ground of the trend in other European countries. It is the benefits from the SPAT study. Then you can see between 2007 and 2011 increase in the Poland, and in the same time the stable trend in the other European countries. So we can say that in other European countries, they maybe manage better the cannabis problem than in Poland. It is still the hypothesis. But we cannot say that this increasing trend illustrate or are just the element of the common European trend. So therefore, I really would like to encourage you to contribute to international epidemiological project like SPAT study, because you can see much more about your situation. And this cannabis use we can see also not only using this SPAT data, but also the general population data and the number of offenses detected by the police, and you can see exactly the same trend. Some decrease in 2007, but the long trend is still increasing. And the next indicator from the SPAT study, the perceived risk related to cannabis use. They are the percentage of the students who answer great risk when they were asked about the risk related to cannabis use. And there are three indicators. The first one is related to the first attempt of cannabis use. That means somebody used cannabis once or twice in the lifetime, then they smoke cannabis occasionally, and then they smoke cannabis regularly. And you see that is in all indicators decreasing trend, and especially accelerated in 2011. So we can say that all this action, which was focused on convincing people that the cannabis use risk is very high, failed. So the youth have their own experiences. The youth looks at the situation in the different way. And then some word about the penal policy in Poland. Till half of the 90s, and in the 80s and first half of the 90s, the illicit drug possession was not penalized in Poland. We have quite liberal policy, which was more focused on the prevention, on the treatment, but not on the repression measures. And on the basis of research findings, most of the European countries in that time have very liberalized their own policy, because in the most European countries in that time, the drug use, even the small amount for personal use, was penalized. And because this penalization policy was not effective, didn't lead to decrease of prevalence of drug use, reinforce health deprivation and social exclusion of drug users, and also was extremely expensive, most European countries liberalized the policy and just canceled this penalization of drug possession, small amount for personal use. In Poland, it was totally different or opposite trend. In '97, we adopted the new law penalizing illicit drug possession, but with exception of small amount for personal use. In 2000, we amend this law, extended penalization to cover any possession, even small amount for personal use. So if a young person have even one joint and is catched by the police, can be put into prison. But in 2011, the probation measure was extended, so this policy was to some extent at least liberalized. Why? Because if you look at this slide, you can see the number of the drug-related offenses detected by the police, and you can see that after both changes of the legislation, the number of offenses dramatically increase. And what kind of offenses? Especially the drug possession and the drug provision or procuring. Not the drug selling, but if somebody shared the drugs or give to the other. And the other type of the offenses, this area which is yellow on the bottom of the slide is have the same. Yeah, this is not illustrate not increasing trend. So we can say that all these penal measures, in fact, create the new type of the criminality, the drug possession, or have impact on this part of criminality, which is really related to the drug use, not to the drug trafficking, smuggling, and so on. This part was not changed. And when we look at this drug-related offenses detected by the police and sentences by the court, we can see very increasing trend of these convicted cases, much quicker than the trend of the offenses detected by the police. They are indexed data, that means they are shown in the relation to the data from 1990. So you can see that till 2007, this bot line increased and this core data increased much quicker. And then we can see that this penal policy slightly changed. So the number of the offenses detected by the police slightly increased, but the number of the people convinced by the court slightly decreased. So that's the practice could be said was before the changes of the legislation. And then we have the perceived drug availability, which could be the indicator of the availability of this drug, so that it was expected that this new penal policy will reduce the availability. We can see that it is not the case, especially when we talk about the cannabis. The other drugs slightly reduced, but not the cannabis. And then 2 minutes. So maybe I will skip this part concerning the treatment. I will only show you these results about the mortality of the problem drug users. They are the findings of the cohort study. And what we can see here, we can see the standardized mortality ratio. That means the ratio which illustrates how bigger is the mortality among the drug addicts compared to the mortality in general population. And we can see that in 2000, among the total drug addicts, this mortality was 17 times higher than in general population. But when we take only opioid addicts, we can see that it was even 30 times higher than mortality in the population. And then we can see very decreasing trend, very rapid in the beginning of this century. And finally, in 2013, we have only 2 times higher mortality among drug addicts than among the general population. And it could be considered to be the effect of the treatment policy and harm reduction policy. So that is, I think, big achievement. And conclusion would be that drug use prevention is still not able to manage to reduce cannabis use, but other drugs use prevalence decrease, it is important. And penal policy produce criminality by penalization of drug possession and is not visible impact on drug availability. And the treatment and harm reduction, we can see the decreasing trend in mortality among drug addicts and also the incidence of HIV infection, which I didn't manage to show because of the time. And now the methodological problems of evaluation, which are related to the restriction and limitation of conclusion. So the alternative interpretation of the changes in the epidemiological indicators is always possible, so we cannot control all factors other than the drug policy. And we are not take these factors under strict control, so they are only hypotheses. And there are also a lot of problems with data validity, reliability, and comparability over time. Thank you for attention.
Thank you, Janusz, for your second presentation, which happened to be the first one. I would suggest now, if we continue with the program, our first speaker should be, as I said before, Mr. Björn Hybel, who was supposed to present us information about ESPAD study, which is the world's largest school survey on substance use. I hope his presentation is now available because it's going to be presented by Mr. Janusz Sieroslwski.
Or maybe now we'll ask our colleague from Lithuania to present their presentation, and I will go to the end. That's depends on.
It would be logically, I think, continuation logic, because you have spoken about ESPAT as well. Yes.
Okay, this is already. Okay, so I would like now to say some words about the ESPAT study, the world's largest school survey on substance abuse. This presentation is prepared by Björn Hibel, who is the coordinator of the ESPAT study from the beginning. That means already 19 years, or even more, because the study started in 95. The content of the presentation will be why school survey, then the short presentation of the ESPAT, then some results of the ESPAT, and then some words about the participation of the Turkey in this exercise. Thirdly, why school survey? And the school survey is very important and useful tool to monitor the drug situation, because firstly it's very cost effective. The data collection is relatively cheap, especially if we compare to the general population survey. It's relatively easy to conduct, reach a large number of students in one setting. It's relatively easy to standardize, and also the sampling is to reach the representative sample is relatively easy. High response rate among students is also usually noted, and high validity of the data collected. That means the more honest answer than the other part of the surveys. They are the privileges related to the school survey. However, the ESPAT or the school survey only includes students. That means not young people are enrolled as a whole. Only the people enroll at the school. So this young people who didn't go to school are eliminated. In some countries, sampling can be difficult according to the school system. The refusing school is a problem in a few countries in the western part of Europe now. But anyway, the ESPAT or the school survey should be still important tool. And what is the ESPAT as a school survey? The ESPAT started in 95 as an agreement of the researchers from 26 countries. 26 countries participated. It was initiated by the Center CAN from the Stockholm, but with the highest contribution of the Pompidou Group. So the Pompidou Group served as a platform to gather all these researchers interested in participation in this survey. And then in 1999 we have already 30 countries. In 2003, 35 countries, and this number of the countries increased over the time. And finally, in 2011, the last wave of the survey covered 39 countries, and hopefully around 40 countries will be in 2015. So it's so broad platform from comparison. On the map, you can see the area of Europe covered by the ESPAT study. So it is, in fact, almost all a continent. Not only European Union, but also a lot of the countries outside of European Union. And some characteristic of the ESPAT: the students that will become 16 years old during the year of the data collection are the target population. The nationally representative sample of classes is taken, and about 2,400 participating students in each country. More than 110,000 European students in 2011 participate in the study. So the sample is really, really huge. And the strategy is to standardize what is possible to reach the as much as possible comparable data. So that this under standardization is the target age group, the random sampling, master questionnaire, study leader protocol, data collection procedure, all these things are standardized, and also the time of data collection. Finally, the common database is created, and the common data cleaning procedure is applied. And all these things are described in the SPAD handbook, which is also available on the web page. And the purposes of the study is to have access to the comparable data on substance use among European students, including as many European countries as possible, and also to monitor the trend in the single countries, in the group of the countries, and also in the whole Europe. But the other purposes of the study is to serve as an alcohol and drug prevention among youth, including national policy and prevention activities, and providing data that can be used as a part of the evaluation of the European strategies and also the national strategies, and how it could be used I showed in the previous presentation. And all the reports from the SPAD study are available for downloading at the SPAD web page, and they are, of course, free of charge. Then there was the Stockholm picture, because Björn Hibel is from Stockholm. And then the question, does a project like SPAD have any impact on the drug policy, on the drug practice? And in 2012, the impact study was conducted amongst stakeholders. So the media interest was quite high, 61% interviewed the practitioners, policymakers, and researchers give such answer. Then interest among the politicians was even higher, 71%. And the SPAD 2011 reports used in the public drug debate in various countries, it is closely to 90%. So now some SPAD results. On this slide, you can see the lifetime use of marijuana or hashish by gender in the 19 countries which participate from the beginning till the end of the project, and had the all measurement points. And as it was seen before, it was the increasing trend till 2003, then the stabilization. And this is the average situation, but this situation is very differentiated in the countries. So in 11 countries, the marijuana use increase, in 6 countries decrease. So it contributes to this general average. There are also the results about the lifetime use of marijuana, and maybe it is not very readable, but you can see this huge discrepancy among countries. How big are the results in the Czech Republic, for example, which took the first place, and then in Bosnia and Herzegovina, which is on the end of this ranking. And then the proportion of students having had 5 or more drinks on one occasion. This indicator so-called binge drinking. And what we can see on this slide is very interesting changes according to the gender. So we can see that till 2007, the prevalence of binge drinking among girls increased much quicker than increase among boys. So this differences between boys and girls was just very, very reduced. And it could be interpreted as a changing of the position of the woman in the society, or the gender issue. You know, that's this cultural explanation of such trend. And then large differences between countries. You can see here some ranges. Cigarette use, for example, last 30 days. 33% for the all study, and then the differences between 43 and 10%, and even in the cannabis between 24 and 1%, or illicit drug other than cannabis from 16% to 2%. So these discrepancies are very, very big. So the analysis of the country situation on the ground of the other countries is very, very useful. And what happened now? We are planning the 2015 survey. It will be the regional seminars in October preparing this survey. So in March, April 2015, the data collection is foreseen. 15 August 2015, delivery of the national data set and country reports. November 2015, national data set will be ready. And finally, in the mid of 16, we will launch the new 2015 SPAT report, and we will see how the trends change over the last 4 years. And at the end, some two words about the Turkey in the SPAT. Turkey took part in SPAT in '95. The Istanbul was covered only, and in 2003, the 6 cities were covered. So you have the 2 measurement points. And it is also now discussion prior to the, there were the discussion prior to the other data collection, but finally it was not successful. So Turkey is welcome to back to the SPAT in the new wave, and you can obtain the data which will be comparable with the other European countries, but also in the data which you already collected in 2000 in previous 2 waves. So the data about the use of cigarettes, alcohol, cannabis, other illegal drugs, inhalants would be possible to obtain. So thank you for attention, and I really would like at the end to promote this SPAT in Turkey. Thank you.